Okay, who is familiar? Now, a VAD is really a ventricular assist device. There's a right and left one. Some have both. Some have only a left. I don't know that much about them. There was a patient, I actually knew the guy for years and years in Salem that had an LVAD.
Transported in the Baxter.
Quite a few. He eventually died 2 or 3 years ago or something. Lose track of time. But he had one. That's the only person I've ever known. And I didn't pick him up.
With a man at Cherokee Gas up on Kid Killer that had
one.
There was one toward the Baxter Colony. Baxter Colony.
Yeah, right. I mean, you went on that. I didn't. So I stand corrected. It was 2 that I'd heard of.
So I've got a stupid question. How do these? Well, this is pretty stupid.
I'll give a stupid answer.
Okay. How do those patients die if it's mechanically assisted?
Well, because I understand that, but at some point your organs start failing. I mean, let's think about it. That is not as efficient as a patient or person's heart.
Right.
They may start with renal failure. Renal system may shut down. There's a lot of factors that take place. And here's another one, Tia, and I'll talk about it very briefly on LVADs that can happen. Okay. And maybe why that person died or that other person died. I don't know, but this is something that would probably be what caused it, other than maybe kidney or renal failure, etc. Okay. Well,
one that you were talking about Cherokee, because I think we talked about this once. Did he have one of those continuous pump? It didn't pump, so there was no actual. You couldn't get like a blood pressure.
That's on LVAD. You're not going to get a blood pressure on LVAD when there's
continual flow.
I'm going to cover how you can get a blood pressure, but we're not able to in the pre-hospital setting.
But I thought there was more than one kind. Maybe I'm just.
There probably is, David. Let me just state right up front, I'm not that familiar with LVAD. I've done research on them, but I don't understand them. So way above my pay grade.
I just remember reading about one developed in England, and the guy tested it by pumping out his basement that had flooded.
Well,
worked fine.
Could use a sump pump, but other than
that was the research on it.
Wow.
That was evidence-based research.
Okay.
It worked fine.
Here's what I love. I got this off of doing research. I didn't come up with this. LVAD. CPR is not recommended on a patient with LVAD. Okay, period. But then the next thing it said, only start CPR if it's obvious the person is in cardiac arrest. Okay, first of all, when would you start CPR on a patient that wasn't in cardiac arrest?
Exactly.
I mean, I've seen it done. What we're smarter than is volunteer service years ago. The patient was fighting them off. Seriously, I'm not exaggerating.
It wasn't just south.
If you went to Glencoe and maybe made a right out there somewhere in that direction. But that's been a long. Okay, so we know we don't start CPR on patients that are not in cardiac arrest. Well, that's not necessarily true. If it is a neonate or an infant, there are times that you do if the rate is real low. Okay, what's an LVAD for? It's a temporary measure. Temporary treatment. Patient ain't gonna live with us forever and ever. Why they put an LVAD in, or if it's the right and the left, is to give them time, because they're on a transplant list, to be able to live until that point that they can get a heart transplant. Now, here's something that I would assume they couldn't be a contact sport, but they did not realize that they could not swim. But it makes sense after you look at somebody as an LVAD. Yeah, it makes sense why they would do this.
My younger cousin had one from the time she was 5 until she was 9, and she finally got her heart.
Oh.
Okay, slightly different. It stands for what would a right VAD be used for? What blood from the right ventricle through the pulmonary system. Basically, that's the only difference. And like I say, some people have both. Okay. Already talked about that. Transform to appropriate facility. That's kind of like, okay, what do you do? What is actually wrong with that patient? If it's something with the LVAD, Fulton's not gonna know what to do. Baxter, OMC is not, they need to go where?
Heart.
Probably to the Heart Baptist or even Barnes
Yeah.
Jewish. But we're not gonna take them in the pre-hospital setting to that location, obviously. Okay, one thing about an LVAD, when you listen, it's at the 5th intercostal space. And what you'll hear is a kind of a whirl. Now, you can palpate, try to palpate a pulse on the field one. Okay, you're not gonna get a blood pressure unless you can get a blood pressure using a Doppler, which we don't carry Dopplers. Now, in the ED, they could do that. We don't have that ability. Getting back to what you said is, why do they die? Okay, when you're listening, that 5th intercostal space, if you hear something that sounds like ice crunching, that means it's clot formation. So they're probably throwing a clot, and including like an LAD, RCA, circumflex, whatever, or it goes to the brain and they stroke out.
Okay.
So if you hear that sound, you know it's not normal. There's not much you can do about it, to be honest with you. It's transformed to the hospital. And there again, I'm not an expert in anything, and I'm sure not on VAD.
Even, isn't sustainability like 5 years? Or is it,
I don't
well, she
know.
was on, the one across the street was on it for 10 years.
Was it that long?
It was a while.
Yeah, I don't know, Tasia. I did not read that when because I didn't want to get into it. And actually this a few years ago, but I did go back and look at some other data. But I don't remember any time frame that they said. The only thing I remember is a temporary, not a fix. It was a temporary management
I
until they
want to
could
say
get a heart
5
transplant.
to 7 is.
Okay, I'm gonna believe you because I don't have a clue.
There was,
Any questions on that?
I do remember reading about, when I, talking about the same, when at the same time I was reading about the guy who pumped out his basement with it. It had been used for someone who had a significant cardiac viral problem,
Mm-hmm.
and they put him on one to give the heart time to heal.
Okay.
And once the heart started beating on its own, they weaned him off of it.
Really?
But that was, I don't know if that was just a special case or what. I just remember, that's been a while. That's been a while.
I don't know, like I say, much about that. I know the first person had a quote mechanical heart, and it was probably weighed 40 plus pounds. It was a dentist named Clark. I can't remember his first name. This was back in the 80s.
Yeah.
And he lived for a short period of time.
Yeah.
And then he didn't get a heart, etc., and passed away. But that's, I mean, it was a big device. He had to wheel it around on like a little cart apparatus. Okay. We're going to go through this quickly. We just have some case studies. And am I supposed to sign my own name?
I got you.
Okay.
I got you.
Appreciate you.
That's a big thing.
Okay, acute coronary syndrome. We have worked a lot of cardiac patients in our careers, be it 40 years, be it 2 years as a medic. So a lot of our calls that are truly life threats. And you can see here, and I'm going to read all this, but stable angina, unstable, non-STEMI, and STEMI. And there are ways to tell which is which. A STEMI to me is pretty easy to determine that, hey, this patient is probably having a STEMI. We'll just go over some of the differences obviously between them. I'm not going to go through this coronary artery with it. Well, one thing I do want to go over just very quickly. Okay, you have two main coronary arteries. You have more than two. You have more coronary arteries than two, but your main, you have the right and the left, and then it branches into, and you can read as well as I. And obviously the right coronary artery and its branches feed the right side of the heart, the left coronary artery and its branches feed the left. And there's one up here that if your patient has an occlusion in the LAD is the largest coronary artery, by the way. What happens to those patients that are 100% occluded? What happens? They die.
So
Yeah,
say,
I was gonna say,
Unless you can get them to a PCI capable hospital ASAP. So so that they can do what? Stent it. Or if they had to bypass. That one's called the Widowmaker. If it's blocked, dead. There's people out there that appear to be healthy, walking around, boom, 40 years old, fall over dead.
How many did Gary?
And now
Moore
they
have?
did.
Stents,
Yeah.
Gee.
12.
Yeah, he had a family history, very significant for
Oh.
coronary artery
Yeah.
disease. His brother died of it. I think his dad did also.
Chris Furlong, be nurse, ground, and police officer. He's got 13 right now.
Does he really?
Good
Chris
Lord.
Furlong
That, to
I
me,
did
would be
not know
about a
that.
record.
was married to Mecca, or is married
Is
to
married to
Mecca. Yeah. Yeah, his last one, he got 3 stents. They left White River. He made her stop at Freddy's and get him a cheeseburger before he got from Freddy's to Cherokee Village. She had to pull in there because he was having another damn heart attack.
That's, wow. He used to work here.
Yeah.
I worked with him up in prison.
Really? I hadn't
He
seen him in years.
used to
He,
own the restaurant, or, yeah, he managed the restaurant on the corner of 223 and 62.
Okay.
And he was my boss. So,
Okay.
He used to make strong coffee.
Anyway.